Okay, Dr. Kevin Kavanagh joins us now. Good morning, Doc.
Good morning, Jack.
Dr. Kavanagh is a retired physician. He's also the founder and president of Health Watch USA. And I knew it was going to happen. I said it on the radio, but you give people an inch, they'll take a mile. And health officials in Missouri are telling everyone who packed into those parties at Lake of the Ozarks to self-quarantine for 2 weeks. Quote, this reckless behavior endangers countless people. I'm sure you saw the video of that, didn't you?
Yes, I did. It was pretty depressing. And I should add, the one bar in, I believe it was Lexington, wasn't much better.
Yeah, they got cited, didn't they?
I think so, yes.
It's just we don't use good sense. I mean, we've been pent up in our homes and we have an opportunity to get out. We forget everything that we've learned up to this point, which is just ignorant. It's not ignorant. We know better. It's just stupid.
Yeah, that is absolutely correct.
Now, you sent me some information. You know, we've talked about different businesses opening up, one of which this week, beginning on Monday, hair salons and barbers. And you say you're not exactly sure how you can make this safe. Is that because of such close personal contact that you have to have, or what's your thought on that?
Well, it's both the close personal contact, but it's also the length of time that you're in contact with those individuals. I mean, some patrons will be in contact with the stylist for an hour, and that's a long time. Even if you're wearing a cloth mask, and let's say it filters out 90% of the particles. If you're there an hour, that's like being in close contact to someone who's not wearing a mask for 6 minutes. And that, I think, is going to be hard to make safe. That is one of the more concerning openings that I have. I also am concerned about tattoo parlors, gymnasiums, and also bars. I think that those have not been doing well, because when people get drinking, get rowdy, they tend to aggregate, to not do social distancing, and I think that these are all danger areas. So we need to learn more about how to operate these businesses safely. If you do go to these businesses, please follow guidelines. Please wear masks. And believe me, the wearing of masks is not a political issue. Republican governors from Charlie Baker, Larry Hogan, Mike DeVine, Doug Burkson, and also Governor Hutchinson down in Arkansas are all encouraging their people to wear masks. And so this needs to get done. And remember, this does not protect you as much as it protects the other person from getting this infection if you're carrying the COVID-19 virus.
There's a front page article by Janet Patton in this morning's Lexington Herald Leader that says Lexington restaurants open Friday to dining in the diners, and diners were excited to be out over the holiday weekend, but the health department received only one complaint about overcrowding. Kevin Hall, spokesman for the Lexington Fayette Urban County Health Department, said officials met Tuesday with the owner of the Paddock on South Limestone to address issues including people congregating at the bar. They want to continue working with us to ensure the safety of the community. All said they have COVID-19 related signage up and plan to put more up. They're also saying they will remove some tables and chairs as well as allow people to congregate at the bar. That's as you say, bars is, well, you go to bars to congregate. That's what you go there for.
That's absolutely correct. And it's tough. Even in Sweden, they have social distancing laws and regulations, and bars are one of them. And they've had to close down a bar, at least according to some European news media, due to people congregating when they shouldn't be. So this is a problem. You tend to congregate at bars more than you do in restaurants. And as I said before, if you're going to a restaurant, make sure that the food preparers and the handlers are wearing masks, even if they're just doing pickup service. It's important. Remember, it's a respiratory virus, and there are concerns that this could be spread between the person who is preparing your food and getting onto the food or what they're preparing and then giving it to you. Is it likely to happen? Probably not. But look at what we went through with our guidelines and what we've done to prevent E. coli and salmonella. You don't have to have a lot of cases with those organisms to raise a lot of concern. So certainly at this point, I think we should be on the side of safety. And hopefully with the warm summer coming, that this virus will start to abate and the epidemic will wane. And that's what I've been hoping for. And as you know, Jack, we've talked about that for several weeks. I've been kind of an outsider on that, but now I think more people are coming around that, hey, this may get less severe during the summer, but let's not get lulled into a sense of security.
Well, Dr. Kavanagh, ideally, what would this summer look like, just from a big picture view? Can we have some fun? Do we need to still stay home? What do we need? What do we have to look forward to, in your opinion?
No, I would go out and enjoy the outside, still social distance, go on walks. I think that is an ideal time to do it, and not congregating indoors because you don't have good air circulation. You certainly can spread the virus if you go into a retail establishment. You have COVID-19, but you don't know about it. You're an asymptomatic carrier. You're not wearing a mask. You put everybody at risk. So outdoors, I think, is good. The warm, humid weather is something the virus does not like. And all of that, I think, will result in the numbers going down, which they're still going down. And my concern is for the fall, because I think it is very likely the virus will come back in the fall. It's going gangbusters in Brazil right now. Their death rates were greater than those in America yesterday and over the weekend. So Brazil is a concern, and it can jump back again to our hemisphere from Brazil, and we still may have some focuses in the United States. But hopefully in the fall, we'll have better testing. We'll have our contact tracers set up. We will have a healthcare system that's ready to go, and we may be able to just snuff it out and make it so it's not a huge problem. But that's if everybody follows guidelines. It's not if we go out and act like, well, I hate to say this, but like idiots, and think, oh, everything's fine because someone said the virus is gone, and we'll get new cases coming about.
Dr. Kevin Kavanagh, thank you very much. We'll talk to you again on Friday.
Okay, thank you very much, Jack. I appreciate it.